So next topic is the inflammation. What is inflammation? Inflammation is defined as how the body reacts to the injury. So what is the main goal of the inflammation? The main goal of inflammation is to remove any harmful agents and the dead cells in order to heal the tissue. So think of it as a cleanup and repair mechanism that comes to fix things after the damage occurs. Now, what could be the cause of this inflammation? First of all, there could be involvement of infective agents that includes bacteria, viruses, fungi, parasites, and toxins. So, when you get a bacterial infection, your body responds with the inflammation. The second is immunological agents. So these are related to our immune system, like the cell-mediated and antigen antibodies reaction. They can cause inflammation. The third are the physical agents. That could be, these are the things like the heat, cold, radiation, and the mechanical trauma. So example is when you get a burn, the inflammation would occur. The fourth are the chemical agents that include both the organic as well as the inorganic poisons. Apart from that, inert material like the foreign bodies can also cause inflammation. Now let us talk about the difference between the inflammation and the infection. So who can tell me what an infection is? Well, an infection is when the harmful microbes they invade your body and their toxin they will cause ill effect. Whereas inflammation it is a protective response by the body to the various agents whether they are infectious or non-infectious. So inflammation it includes two main processes, the early inflammatory and later is the healing response. Now what are the main signs of inflammation? As discussed by the video, the main signs they are, the first is rubor, that means redness. So that happens when more blood flow to the affected area. The second is a tumor, that is swelling, that occurs due to the fluid accumulation. The third sign is the calor. So the area it makes you feel warm because of the increased blood flow. The fourth sign is dolor, that is due to release of chemicals that stimulates the nerve endings. And the last is the functional loss, that is the loss of function. So this sign was added by Vito and it refers to impaired function of the affected area. So remember these four signs: rubor, tumor, calor, dolor, and additional sign is loss of the function. So during inflammation you will see red line, flare, and V. Now what could be the type of inflammation? It can be either acute. Acute means it's a short or it lasts for only less than 2 weeks. So this type of inflammation it has a quick response. So there is accumulation of fluid and plasma at the site, activation of the platelets, and presence of polymorphonuclear neutrophils. So can you think of situation where you might have experienced acute inflammation? Yes, like in the case of cuts, burns, or infection. The other is the chronic inflammation. So the chronic itself means it lasts for longer duration that is often a month or even the years. So chronic inflammation, it involves the persistence of the causative agent. So you will see chronic inflammatory cells here. What are those? They could be lymphocytes, plasma cells, and the macrophages. And it also involves the formation of the granulation tissue. So a specific situation within the chronic inflammation, it's the granulomatous inflammation. While we know that the inflammation is generally protective, but it can also cause harm. Like in the case of allergies, the chronic diseases like the rheumatoid arthritis or condition like atherosclerosis, this inflammation, it can be damaging. So, can you guess any example of the chronic inflammatory condition? Yes, it could be asthma or Crohn's disease. That could be the example. The other is the subacute inflammation. So it falls between the acute and chronic inflammation. So it does not last as long as the chronic inflammation. Now let us discuss the vascular changes that occur in the acute inflammation. So the first change that you would see is vasoconstriction. So that is the immediate response of blood vessel. So if you get a question, what would be the immediate response of blood vessel? There would be constriction right after an injury. So answer would be vasoconstriction. So it is just like a reflex action. And for the mild injuries, it may last for the 3 to 5 seconds, and for the severe injuries, it can last up to 5 minutes. Now, can you think of why body might want to constrict the blood vessels immediately after the injury? Yes, in order to minimize the blood loss. So in order to minimize the blood loss, the blood vessels immediately constrict after an injury. After the initial vasoconstriction, there is a prominent and progressive dilation of the arterioles, venules, and the capillaries. So these reactions start within half an hour of the injury. So what do you think happens when the blood vessels would dilate? Yes, there would be increase in the blood volume, which leads to redness and warmth. So the third step is transudation. Due to the elevated local hydrostatic pressure that causes fluid to leak into the extracellular spaces, that would result in swelling. The third is the stasis. The slowing of the microcirculation increases the concentration of red cells and the blood viscosity. The next step is the neutrophils, leukocytic margination. We know neutrophils, they are type of WBC. They line up along the vascular epithelium, stick to it, and migrate through the gaps in the endothelium into the extravascular spaces. And this process is known as immigration. Now, why do you think neutrophils move out of blood vessel? So they move to the site of injury to help fight off any germs or any harmful substances that might be there. Now the triple response, according to the Lewis, he demonstrated the vascular changes in inflammation and he called them as triple response. So what are those? A red line, flare, and V. So the red line, when you lightly scratch the screen, you see a red line. So that is due to the local vasodilation of the capillaries and the venules. Surrounding the red line, there is bright red flush that is known as flare. So that happens due to the adjacent arteriolar vasodilation. Finally, there is swelling or edema from the fluid transudation into the extravascular space. That is the V. Now let us talk about the edema. There are two main types of fluid that can occur. One is the transudate and other is the exudate. So remember, the transudate, it is a fluid with low protein content. So that this transudate, remember, it will comes from the increased pressure that is inside the blood vessels. That is the hydrostatic pressure that is pushing the fluid out or into the tissues. The other is exudate. So this fluid, it has a higher protein content and it is caused due to the increased permeability of the blood vessels that allow the protein and other substances to leak into the tissues. Other is the Starling hypothesis. Normally remember that there is a balance of forces that keeps the fluid inside the blood vessels. The outward forces that include pressure inside the blood vessels, that are the hydrostatic pressure, and pressure from the fluids in the tissue, that is the interstitial pressure. The inward forces, these are the proteins in the blood that pulls the fluid back into the blood vessels, that include colloid osmotic pressure and pressure from the tissue fluid. So during inflammation, the blood vessels become leakier. So imagine it as a tiny gap opening up in the walls that allow more protein and fluid to move into the tissues. So that happens due to the first is there is changes in the endothelium. So during we know that normally the lining of blood vessel is tight, but due to the inflammation, you would see is during inflammation the lining become more permeable. So chemicals like histamine, they cause gap formation to occur. Like histamine, they causes gap to form between the endothelial cells, letting the fluid through. So there can be direct injury to the to the endothelial injury, like the burns, injuries, or toxin that may damage these endothelial cells. So that will make these endothelial vessels, leaky. Apart from that, the WBC cells, they stick to these. The WBCs, they stick to these. The white blood cells, they stick to these vessels walls and release substance that make the walls leaky. And in the new vessels, like in the healing or tumor, these new blood vessels, they are more leaky. Now, what could be the mechanism of increased permeability? First is the contraction of the endothelial cells. Think of the cells that squeeze together, creating temporary gaps. That occurs after minor injury. So why do you think this happens right after the injury? So that is more likely due to the structural changes in the cell. That is due to the chemicals that are released, like the histamine that could be released, or damage to the direct injury to the endothelial cells, damage that can occur that can cause leaky endothelial walls. There could be damage by the leukocytes. Now, when the inflammation occur, the first step that when the inflammation occur, the first step occur is there is movement of WBC cells from the blood vessels into the tissues. So this is known as cell exudation. Now the type of leukocytes, they could be, the first are the polymorphonuclear neutrophils. So these are the first responders. These are like the superheroes of our immune system. The later they come in are the monocytes and macrophages. They come in later to clean up the debris and continue the healing process. Now let us discuss the stages that lead to leukocyte migration. The first of all, there would be changes in the blood flow. At the beginning of inflammation, there is increased blood flow due to the blood vessel dilation. So the later the blood slows down along the leukocytes to move closer to the vessel wall. The second method is the margination and pavementing. So because of slower flow, the leukocytes they will line up the blood vessels, especially the neutrophils. They will line up along the vessel wall. The third process is the rolling and adhesion. These leukocytes, they start to roll down along the vessel and they then they finally stick to it. So what do you think that helps leukocytes to stick to the vessel wall during this inflammation? Remember that there are molecules like selectins and integrins. So these molecules, they act as a glue. They help the leukocytes stick there and put up. Now the last step is immigration and diapedesis. So now the leukocytes, they will squeeze through the gaps in the vessels and move into the tissues. So how do you think leukocytes find these gaps in the vessel wall? So remember, they follow chemical signals that are known as chemotactic agents. So these chemotactic agents, remember what they will do is they will guide them toward the area of inflammation. So remember that chemotaxis is like guiding leukocytes to the site of inflammation. So once the leukocytes they reach the site of injury, they start cleaning up. The process is phagocytosis. So what are the steps of phagocytosis? First is recognition. They identify and latch on the target, often held by antibodies and complement. Second is attachment. Third is engulfment. The target is swallowed up in a little bubble inside the cell. And last is the killing and digestion. So inside the bubble, the target, it is digested using powerful enzymes and chemicals. So why is, remember, phagocytosis important for our body defense? So remember, it helps to remove the harmful substances and pave the way for the healing. So The cellular events in the acute inflammation, it involves the movement of leukocytes from the blood vessel to the tissue that are guided by the chemical agents. So once they engulf and digest the pathogens and debris that would help our bodies to heal.